Welcome to another episode from the Veterinary Research Channel. Today we are diving deep into a fascinating case that has implications for how we approach fungal infections in our feline companions, specifically a condition known as Sino Orbital Aspergillosis. This case study, recently published in the Journal of the American Animal Hospital Association, details the successful treatment of this disease in a cat using a specific medication, offering new hope for cases that were once considered nearly impossible to resolve. To begin, let's set the stage with some background information. Aspergillosis in cats typically manifests in two forms within the upper respiratory tract: Sinonasal aspergillosis, or SNA, and Sino Orbital Aspergillosis, or SOA. Sinonasal aspergillosis remains confined to the nasal and paranasal sinuses, and, thankfully, it usually responds well to treatment. Sino Orbital Aspergillosis, however, is a more aggressive form that extends into the orbit, affecting the eye and surrounding structures, as well as the paranasal sinuses, which makes it far more challenging to treat. In fact, Sino Orbital Aspergillosis is the most common form of upper respiratory tract aspergillosis in cats, accounting for up to 65% of cases, whereas in dogs, Sinonasal aspergillosis is far more prevalent, representing over 99% of cases. What makes aspergillosis particularly tricky is the variety of Aspergillus species that can cause the infection in cats. Unlike dogs, where Aspergillus fumigatus is the predominant culprit in Sinonasal aspergillosis, cats can be infected by a range of Aspergillus species. Among these, Aspergillus udagawae stands out as a particularly hardy pathogen. Aspergillus udagawae is known to cause invasive infections in both humans and cats, and infections can last up to 7 times longer than those caused by Aspergillus fumigatus. Moreover, Aspergillus udagawae exhibits a significant resistance to standard antifungal therapies, making it a formidable opponent. The minimum inhibitory concentrations, or MICs, of various antifungal drugs against Aspergillus udagawae are notably higher than those for Aspergillus fumigatus, underscoring its resilience. Sino-orbital aspergillosis caused by Aspergillus udagawae has been reported in cats, but detailed accounts of successful treatments are scarce. Now, let's discuss the specifics of the featured case. The patient was a 10-year-old spayed female ragdoll cat. This cat presented with a sudden onset of symptoms including sneezing, nasal discharge, and stertor, which is a noisy breathing sound. Prior to being seen, the cat had been treated with antibiotics, feline interferon, and nebulization. But unfortunately, these interventions failed to improve the clinical signs. Further investigation was clearly needed, so a computed tomography, or CT, scan was performed. The CT scan revealed findings consistent with chronic rhinitis and inflammation of the nasal passages. A tissue biopsy, obtained through Rhinoscopy, which is a procedure to examine the nasal passages, led to a histopathologic diagnosis of Sinonasal aspergillosis. Subsequent polymerase chain reaction, or PCR, amplification identified Aspergillus udagawae as the causative agent. Initially, the cat was started on oral itraconazole therapy. However, despite this treatment, the cat's condition worsened. Clinical signs progressed to include left exophthalmos, which is an abnormal protrusion of the eyeball, nictitating membrane protrusion, or the elevation of the third eyelid, and lacrimation, or excessive tearing. A second CT scan revealed a soft tissue attenuating structure extending into the left retrobulbar space, confirming the progression to sino-orbital aspergillosis. Faced with the failure of the initial treatment, the veterinary team made a crucial decision. They switched the oral medication to Posaconazole. This medication was administered for 5 months, and the results were remarkable. The clinical signs resolved completely, and the cat has remained asymptomatic for over 2 years since the initial diagnosis. This outcome is particularly noteworthy because Aspergillus udagawae is known for its intractability due to its low susceptibility to antifungal agents and poor response to topical clotrimazole. The successful treatment with Posaconazole suggests that this medication may be a valuable option for sino-orbital aspergillosis caused by Aspergillus udagawae. Delving deeper into the diagnostic process, on the first day of examination, the cat exhibited nasal congestion, intermittent bilateral mucopurulent nasal discharge, stertor, lethargy, and a decreased appetite. Although the cat's physical examination and vital parameters were normal, it had lost 20% of its weight in just 2 months, dropping from 4.6 kilograms to 4.0 kilograms. Blood work revealed a mild elevation of sodium levels and an elevated fibrinogen concentration, which can indicate inflammation. Computed tomography and antegrade rhinoscopy were performed. The CT images showed soft tissue attenuating material filling the nasal cavities bilaterally, with mild destruction of the nasal turbinates. The frontal and sphenoidal sinuses were also affected, more severely on the left side, with mild rightward displacement of the nasal septum, but without cribriform plate lysis. These findings were indicative of rhinosinusitis, making neoplasia less likely. Rhinoscopy revealed mucosal irregularity, which allowed for nasal brushing and biopsy. While both the feline upper respiratory real PCR panel and nasal brushing cultures came back negative, the biopsy revealed neutrophilic eosinophilic rhinopharyngitis with necrosis and fiber deposition. Fungal hyphae were observed using periodic acid Schiff and Grocott stainings. Based on a morphology of the fungal hyphae and the clinical presentation, an Aspergillus species infection was highly suspected. To confirm this presumptive diagnosis, polymerase chain reaction analysis was performed. The internal transcribed spacer 2 region of the ribosomal RNA gene cluster and part of the calmodulin gene were amplified. The sequences showed a high similarity to the Aspergillus udagawae reference strain, confirming the diagnosis of Sinonasal aspergillosis secondary to Aspergillus udagawae. Despite initiating oral itraconazole treatment, the cat's clinical signs worsened, leading to the observation of left exophthalmos, nictitating membrane protrusion, and lacrimation. Concurrently, the cat's body weight decreased further to 3.6 kilograms. In response to the progression of these clinical signs, the treatment was adjusted to oral Posaconazole. Initially, a dose of 7 milligrams per kilogram every 24 hours was administered, but the absence of clinical improvement led to an escalation of the Posaconazole dosage to 7 milligrams per kilogram every 12 hours. By day 44, marginal improvements were noted, including reduced lacrimation, nasal congestion, and nictitating membrane protrusion, although the left exophthalmos remained largely unchanged. A follow-up non-sedated head CT scan was performed to assess the disease progression. This second CT study revealed a reduction of soft tissue material in the nasal passages, but also an extension into the left retrobulbar space through the medial wall of the left orbit, resulting in dorsolateral exophthalmos of the left eye. These findings confirmed the diagnosis of Sino Orbital Aspergillosis. On the same day as the second CT scan, elevated liver enzymes were detected, prompting a temporary reduction in the Posaconazole dosage. Liver supplements were added to the treatment. Normalization of liver enzyme levels was achieved, allowing for the restoration of the original Posaconazole dosage. The nasal and eye clinical signs gradually improved, and Posaconazole treatment was discontinued after 4.5 months due to complete resolution of clinical signs. At the 918-day follow-up, there was no recurrence of clinical signs. During this period, several concomitant treatments were administered. For hyperexia, which is a decreased appetite, mirtazapine was given. Mosapride citrate hydrate was also administered, and mirtazapine ointment was used until an increase in body weight and activity level was noted. Additionally, hypokalemia, or low potassium levels, was treated with subcutaneous administration of potassium chloride solution and oral potassium gluconate until potassium levels normalized. It's important to put this case into the broader context of feline upper respiratory tract aspergillosis. As mentioned earlier, Sino Orbital Aspergillosis is more common in cats compared to dogs, where Sinonasal aspergillosis is more frequently seen. While Aspergillus fumigatus and Aspergillus niger are the most common species in cats with Sinonasal aspergillosis, Aspergillus felis and Aspergillus udagawae are the predominant species in cats with Sino Orbital Aspergillosis. These species belong to the section Fumigati, which includes other morphologically similar species. Traditional phenotypic methods for identifying these species can be unreliable, making molecular methods such as gene sequence analysis of ITS, beta-tubulin, and calmodulin essential for accurate differentiation. In the current report, Aspergillus udagawae was identified using PCR of the ITS2 and calmodulin genes, which proved crucial when fungal culture from a nasal brushing sample was unsuccessful. Aspergillus udagawae is known for causing invasive infections in both humans and cats, exhibiting higher resistance to standard therapies and higher minimum inhibitory concentrations for antifungal drugs compared to Aspergillus fumigatus. Detailed treatment and follow-up for Sino Orbital Aspergillosis secondary to Aspergillus udagawae in cats have been described in only a few reports. In one case, a cat was treated with itraconazole, amphotericin B, and micafungin, but unfortunately, the treatment failed and the cat died. 2 other cats were successfully treated, one with high-dose itraconazole and another with a combination of terbinafine, caspofungin, and posaconazole. Cats with sino-orbital aspergillosis caused by Aspergillus udagawae often show low susceptibility to amphotericin B and ketoconazole. Minimum inhibitory concentrations of other antifungal drugs should be examined, especially because amphotericin B is commonly used to treat aspergillosis in cats and dogs, including feline orbital aspergillosis. In this particular case, drug susceptibility testing could not be performed due to negative cultures. Given the reported poor response to regular dose itraconazole or clotrimazole treatment in cats with aspergillosis involving the orbit, treatment with posaconazole was initiated. Alternative antifungals, such as terbinafine and caspofungin, may also be considered for treating systemic aspergillosis. Studies have indicated that combining these with posaconazole can often improve the condition in cats. Initial oral posaconazole monotherapy is often suggested until susceptibility testing results are available. For non-responders, additional drugs, including terbinafine or caspofungin, are recommended. Posaconazole itself is a fungicidal triazole, structurally similar to itraconazole, but designed to be a more efficacious treatment for invasive aspergillosis in humans. It aims to improve upon the absorption, tolerability, and drug interaction profile of itraconazole. Posaconazole is generally well tolerated, with rare instances of liver enzyme elevations following oral administration. In the case we're discussing, liver enzyme elevation was observed, but it resolved after a temporary reduction in the posaconazole dose and the addition of liver supplements. After increasing the posaconazole dose while continuing the liver supplements, no further liver enzyme elevation was observed. However, it's important to acknowledge that concurrent conditions could have contributed to the elevated liver enzymes, making it difficult to definitively attribute the resolution solely to the adjusted posaconazole dose and liver supplements. A daily dose of 7.5 milligrams per kilogram is typically required to achieve a target plasma concentration of 0.5 to 0.7 milligrams per milliliter. However, absorption and accumulation can vary, especially in sick individuals, necessitating monitoring of plasma concentrations. In this case, the cat did not respond to a dose of 7 milligrams per kilogram every 24 hours, but improved when the dose was increased. A decrease to 4.5 milligrams per kilogram every 12 hours caused a relapse, but returning to the higher dose resolved it, suggesting that the previously recommended dosage may have been inadequate in this particular situation. Unfortunately, posaconazole blood concentrations could not be measured. While successful treatment of feline sino-orbital aspergillosis and sinonasal aspergillosis with posaconazole monotherapy has been reported, these cases typically involved Aspergillus fumigatus, not Aspergillus udagawae. The doses of posaconazole used for cats with Aspergillus fumigatus infections were generally lower than what was ultimately needed in this case. There are few reports of monotherapy with posaconazole for infections with Aspergillus udagawae, nor reports of treatment with this higher dose of posaconazole for long-term use, regardless of the Aspergillus species. In this instance, the cat maintained a good body condition during the 4 months of treatment with posaconazole and remained clinically stable for 18 months following the discontinuation of therapy, without disease recurrence. This case stands as the first documented successful treatment of feline sino-orbital aspergillosis secondary to Aspergillus udagawae using oral posaconazole. Despite the positive outcome, it's important to acknowledge the limitations of this study. First, the inability to culture the isolate meant that case-specific susceptibility determination was not possible, which is important due to potential isolate variability. Second, while posaconazole proved effective, further evaluation with a larger sample size is needed to more definitively assess its efficacy for treating sino-orbital aspergillosis in cats. Third, the use of divided enteric-coated tablets, rather than liquid posaconazole, may have altered absorption rates compared with previous studies. Finally, The lack of blood concentration measurements for Posaconazole represents a notable limitation. Continuous monitoring would have provided valuable insights into the drug effectiveness and potential toxicity. In conclusion, Aspergillus udagawae is a significant cause of Sino Orbital Aspergillosis in cats, known for its resistance to many antifungal drugs. This case report demonstrates the successful treatment of Sino Orbital Aspergillosis caused by Aspergillus udagawae in a cat through the use of oral Posaconazole monotherapy, administered at a dose of 7 milligrams per kilogram every 12 hours. This finding offers a promising avenue for treating a challenging condition. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.